Alright, treating the embryonic remnants. So one way to treat the abdomen, you can treat the belly button. So is it okay if I show your belly here? So here's the belly button. One way you can do this is you can take your thumb, put it into the umbilicus, and feel which way there is tightness. This often feels very funny, and you're not going, this isn't exactly a thumb screw, but you hold until you feel the tension unwind. And then you come back to neutral. And then you can also treat the other way by rotating the other way until there's tension. And the tension unwinds. Treating the lateral umbilical ligament. Sometimes it's subtle. Sometimes it feels like the colon. But if you feel just past the abdominal wall, anterior to all of the intestines, you might notice that there's a firm little band. And if you hold that, that will often release. A little bit more medially is the medial umbilical ligament, which similarly can be treated. And then the singular median umbilical ligament. However, you need to add tension to that is fine. But you can treat that there too. And then also treating the falciform ligament that connects the liver all the way toward the umbilicus. There are lots of ways, but essentially you go past the abdominal wall and you can come medially until you find what feels like a firm band. And then when you feel resistance, or if the patient starts looking at you funny, you can stop, hold, and exaggerate the resistance that you feel until it lets go, until you feel a therapeutic pulse, perhaps until your patient takes a deep breath. And once that happens, you can release. And then, as we saw in the pictures, the root of the mesentery comes across the abdomen like this. It's pretty big. So when you're treating the mesentery, it's important to try to get the whole thing. So lots of ways to get there, but sometimes using straight fingers, perhaps even having your patient bend their knees and put their feet on the table to soften their abdomen. With straight fingers, you can sink down, make sure that your patients are not wanting to leave you because they're in too much discomfort. Sometimes this can be uncomfortable because it goes fairly deep. But try to feel the root of the mesentery, the posterior part of the abdominal cavity. And wait until you feel like there is less pressure on your fingers. You'll probably feel fascial creep, potentially some visceral motility and mobility, but you can work your way through the parts of the root of the mesentery by lifting.